Hey everyone, welcome back to our channel. My name is Brianna Wilson. I'm a certified dementia practitioner and the founder of Bambu Care, where you can find us at letsbambu.com. So for today's video, we're going to be talking about 4 common screening tools for dementia. Early detection of dementia is so important. So if you are having challenges with your memory and thinking skills, or someone you know is having challenges with their memory and thinking skills, then it is so important to go to the doctor so that they can perform some of these screening tests, okay, and also do further testing to figure out what is actually going on, okay? Now, if you're looking for a test that you can take yourself and then take to the doctor for them to talk about your results and all that good stuff, then I highly recommend the SAGE test. That test was created for you to take yourself and then take it to the doctor for them to score it and interpret the results and then tell you the next steps based on how you scored, okay? So the screening tools that we're going to be talking about are actually tests that healthcare professionals can do to screen for dementia. And I just want you to be aware of some of the options that are out there so that even if the doctor isn't bringing them up, you can better advocate for yourself or for someone you know, okay? So let's take a look at our first screening tool, which I will put up on the screen. So this is the Mini-Cog, and the Mini-Cog is a screening tool for the early detection of dementia. It usually takes less than 10 minutes to administer, and the person administering it doesn't have to have any special medical knowledge or anything like that. It can be administered by any care professional in the medical or community setting, and the whole purpose is for the person to determine if further in-depth cognitive evaluation is necessary. And the Mini-Cog is recommended to be done on an annual basis to kind of just stay on top of things. Early detection is the key, right? So the test is looking at attention, auditory comprehension, and the understanding of verbal instructions, and then short-term memory and delayed recall with the 3-word registration and the 3-word recall. And it's looking at memory, visual spatial and visual constructional abilities, and spatial orientation, motor skills, and executive functions with the clock drawing test, okay? Now, scoring-wise, the highest that a person can score is 5, and a total score of 0, 1, or 2 indicates a higher likelihood of clinically important cognitive impairment, okay? But again, this is not diagnostic. This is just a screening tool, and so it doesn't automatically mean that someone who scores low has dementia. And also, even if a person scores normally on this test, but they're complaining of memory and thinking challenges, further assessment still needs to be done, okay? Next up is the Mini Mental State Exam, or the MMSE, which is another screening tool for cognitive impairment, and it also usually takes less than 10 minutes to administer. Now, this screening tool is probably one of the most recognized for assessing a person's cognitive state. And it's usually used to determine if a person has mild cognitive impairment, but honestly, it's usually a little bit better at monitoring subtle changes in those who have moderate to severe dementia. So for those who are already known to have dementia and kind of seeing if there are any changes going on, okay? But this test has 11 questions that assess 5 primary areas of cognitive ability. So orientation, registration, attention and calculation, recall, and then language and praxis, okay? Now, any healthcare professional can administer this test, but training is preferred and the person actually has to pay to be able to administer it. It didn't used to always be this way, but that is a thing now, which is kind of unfortunate, but I get it, but still, okay? Now, with the Mini Mental State Exam, the highest that a person can score is 30. So if a person scores 18 to 23, then the interpretation is that the person has mild cognitive impairment. If the person scores 0 to 17, then the interpretation is that the person has severe cognitive impairment. But either way, if the person scores less than 24, then it is recommended that further testing be done, even a full diagnostic kind of workup, and proper referrals be made if necessary, so that they can figure out what's really going on, okay? Next, we have the MOCA, or the Montreal Cognitive Assessment, and this actually assesses quite a few things. So it looks at visual, spatial, and visual constructional abilities, executive functions, naming, short-term memory and working memory, attention, auditory comprehension and following directions, language and verbal fluency, abstraction, delayed recall, and orientation. Now, the whole purpose of the MOCA is to detect cognitive impairment. And in fact, the MOCA is recognized as a screening tool with the earliest and most accurate detection of mild cognitive impairment. Now, this test does take a little bit longer to administer, about 10 to 15 minutes, and it can be administered by any healthcare professional, researcher, or worker who has gone through official MOCA training and certification, okay? Now, it didn't used to always be this way, but over the years, it has become more regulated, okay? Now, one of the cool things about the MOCA is that they did a really good job at accommodating different needs. So, for example, they have a MOCA blind for those with visual impairments. So, I think that's pretty cool. Now, as far as scoring goes, the highest a person can score is 30, but there is a 1-point adjustment, so a 1-point increase if the person has 12 or less years of school, okay? But generally speaking, if the person scores between 18 and 25, it is interpreted as mild cognitive impairment. If the scores are between 10 and 17, it's interpreted as moderate cognitive impairment, and scores less than 10 are interpreted as severe cognitive impairment. And then the last screening tool that we're going to talk about is the SLUMS examination, or the St. Louis Mental Status Examination, and this is another screening tool for mild cognitive impairment and dementia. This one also takes about 10 to 15 minutes to administer, and it can be administered by any healthcare professional that watched a training video essentially and rewatches a training video every year, but it's honestly not regulated, not like the MOCA is, okay? But this exam is looking at attention, immediate and delayed recall, basic math calculations, orientation, registration, visual spatial skills, and executive function skills, and this test also has 11 questions, okay? Now, as far as scoring goes, 30 is the highest that a person can score on this test as well. And if the person has at least a high school education and scores 21 to 26, it is interpreted as mild neurocognitive disorder, which is just a fancier way of saying mild cognitive impairment. That term is becoming a little bit more popular now. If a person scores 1 to 20, it is interpreted as dementia. But again, as with any of these screening tools, it should not be a stopping point, but rather a starting point. If a person scores outside of the normal range, then further assessment and testing needs to be done, whether it's another cognitive assessment and evaluation, or lab testing, or brain imaging, or referral to someone else who can look at whatever they need to look at. But the point is, with any of these screening tools, this is not the end-all be-all for a diagnosis of dementia. This is a starting point to see if something needs to be looked into further, okay? But I hope that you found this video helpful. If you have any questions at all, please let me know down below in the comment section. And until next time, bye guys.